Hi, I'm Chris Pedotto, Executive Director of the Recovery Center of Hamilton County, and I want to say thanks to NCCPA Health Foundation, the Mount St. Joseph University, and in particular their Physician Assistance Program for their financial support and collaborative efforts in helping us to create Closing the Gap Through Art, an art show that will be on display at the Art Gallery on the Mount St. Joseph University campus.
I'm Amanda Stoddard, Communications Director here at the Recovery Center of Hamilton County. The Recovery Center of Hamilton County is a peer-run organization located in Cincinnati, Ohio. Our goal here is to get people who struggle with mental health issues reintegrated back into their community. And we do so through a class-structured based schedule. And we offer classes like job readiness, GED prep, but most of all, we offer art classes. And these art classes, time and time again, have proved to be vital in the recovery of the peers that we serve here. We're really excited about this partnership, and we're really excited to close the gap through art.
I am someone who is a person in recovery from severe mental illness. I, as part of my recovery process, engaged a lot of time in photography. That probably pretty much was the extent of my artistic skills, but it's an important part of it, and this is what I like to do.
Well, the art I created at the Recovery Center is a big part of my recovery.
That's the most thing I get out of it, is that it makes them smile.
It relaxes me. I come from home, I leave all of my stress and all of my problems and the problems I can't fix and the worries that I can't do anything about, and I come here and I get into my art and all that goes away.
Art is a big part of my recovery. I like to experiment with different types of media, and my newest type of media is spaghetti noodles, dried spaghetti noodles, to paint.
Photography became a way for me to take my camera and capture emotion, and it was a way to release that emotion for me. I struggled a lot with racing thoughts, and so I learned that when I was focused on composing an image, for example, a landscape, that would stop the racing thoughts.
If I draw a scenery, I'll be feeling like I'm there. So it's like my emotions, if I'm drawing something calm, then, I'm feeling calm.
Art makes me feel more calm and collected, and it helps me keep my thoughts together. It also helps with self-expression with some of the darker emotions that I have.
I like to do a lot of my work in color pencils. Like the one picture I done of the bird of paradise. It's just a feeling that it's a free feeling, like the birds are flying around. It's just free, like a free feeling that I have no worries.
And so it's just been a journey that's been a wonderful journey for me, and now I'm able to truly be a photographer out of a hobby. It's no longer something I do because of dealing with mental illness. It's something I do because it's part of who I am.
Art is a way I can express my emotions without words. When I'm engrossed in a piece of art, it helps alleviate burnout, anxiety, and depression. It is an escape from stress and relaxes me. In a world where I feel broken, art gives me a feeling of pride and self-worth.
As you can see, members of the Recovery Center of Hamilton County use art to help heal and overcome the stigma and social barriers that arise due to a mental health diagnosis. They deal with issues like isolation, lack of understanding, lack of resources, poverty, discrimination, and many other obstacles. At the Recovery Center of Hamilton County, we value creativity as a means to heal and to provide the hope that recovery is possible. We hope you enjoyed the art. And to learn more about the Recovery Center of Hamilton County and some of the services and activities we provide, visit recoverycenterhc.org.
As an undergrad student at MSJ, I had the opportunity to work closely with the Recovery Center of Hamilton County as part of a learning service project. Through this experience, I was able to hear stories of individuals who are affected by mental health diagnosis and was made aware of some of the challenges that this community faces out in society due to social stigma. As a PA student, I became aware of additional social issues, including reduced life expectancies and higher prevalence of developing chronic conditions. This motivated me to pursue the NCCPA Health Foundation Community Outreach Grant and create a project that not only promotes recovery through art, but also aims to reduce social stigma, increase awareness to social issues, and educate current and future professionals in diverse fields.
The title, Closing the Gap, highlights the efforts to reduce the gap in health disparities faced by individuals who are diagnosed with a mental illness. The National Council for Behavioral Health cites mental health as the largest health disparity in the United States. While other differences leading to disparities such as gender, race, and socioeconomic status are slowly closing, mental health disparities are not narrowing. For this reason, it is critical to take initiative to reduce these disparities by promoting a holistic approach to recovery that not only promotes mental health recovery, but also promotes physical wellness and social integration.
As future healthcare professionals, PA students must recognize the social barriers that the mental health community faces and how it impacts their physical health in order to adapt our future practice to better serve this community and reduce the challenges that lead to reduced life expectancies from preventable chronic conditions.
Individuals with a mental health diagnosis face numerous barriers to employment and economic stability. These include discriminatory attitudes of employers, barriers to education, and low expectations. Neighborhood and physical environment significantly impacts health and well-being. Individuals who are diagnosed with a mental health diagnosis often live in areas with high rates of violence, unsafe air or water, and other health and safety risks due to low socioeconomic status. Those who suffer from severe mental health conditions have been reported to have lower educational attainment than those who are not affected by a chronic mental health condition. Education allows patients to be more involved in their healthcare plan and treatment, leading to overall more favorable health outcomes. In addition, they may be at higher risk for food insecurity due to limited employment opportunity. Low food security reduces quality, variety, and desirability of diet that promotes a healthier lifestyle. The World Health Organization identifies stigma and discrimination towards mentally ill individuals as the single most important barrier to overcome in the community. Multiple studies have found that stigma associated with mental illness often prevents patients from seeking and adhering to treatment. People suffering from mental illness are often stigmatized as being unpredictable, different, crazy, or even dangerous. This negative stereotype leads patients to attempt to distance themselves from the labels that mark them for social exclusion, preventing them from getting adequate health care. All of these factors combined create significant barriers in the access to quality health care among individuals with chronic mental disorders.
The World Health Organization cites that individuals with severe mental disorders tend to have a 10 to 25-year decrease in life expectancy than the general population.
A vast majority of these deaths are caused by chronic medical conditions such as cardiovascular disease, infectious disease, respiratory illnesses, diabetes, and hypertension.
It is reported that individuals with mental health disorders have a higher risk to develop these preventable chronic conditions due to receiving lower levels of healthcare, treatment, and social services than the general population.
In relation to the impact that social determinants of health have on physical and mental health outcomes, people with mental disorders are often at a disadvantage compared to the general population due to unemployment, living in institutions, isolation and exclusion, and socioeconomic status.
Increase in suicide rate is another leading cause of premature death in individuals with a psychiatric diagnosis.
Strategies to improve health and life expectancy should focus on improving quality health care access, social services, and reducing social stigma.
The World Health Organization suggests that as healthcare professionals, we need to create protocols in the areas of prevention, identification, assessment, and treatment, improve healthcare access, and strengthen the bridge between physical and mental health, work to overcome the stigma of mental illness, and promote multidisciplinary education.
We hope you enjoyed this presentation. We would like to give a special thanks to the Recovery Center of Hamilton County and the NCCPA Health Foundation for their collaboration on this project. Velma Daly for the display of the artwork at the San Gussip Art Gallery. Our faculty advisor, Jen Garrett, Program Clinical Director, and Patrick Cafferty, the Chair and Program Director, as well as John Moore and Sally Scuglio for the promotion and dissemination of this project and all those who collaborated in this process. Thank you.